NIMS. This is Dr. Sundeep Mishra. I am Vice Chancellor of NIMS University, Rajasthan, Jaipur, and I am also Director of NABH Hospital of Jaipur. First of all, greetings for World Heart Day. I wanted to bring an issue into your notice. You might have noticed that a lot of young people are dying of heart diseases and basically cardiac arrest, and many of them are very active athletes. Some of them use gym. Many Bollywood people are also, quite have good fitness, but still they are supposedly having heart attacks and dying out of it at a very young age. So it has been assumed that it is because of heart attacks, and it is thought that probably they were having some pre-existing heart disease which were not producing any symptoms, which they completely missed, and they developed this cardiac arrest and they died out of it. But I have to say that the autopsy or postmortem has not been done on these people. So we really don't know 100% it is because of heart attack. Another important possibility is that many of them are, or at least some of them are depressed, and they are taking tricyclic antidepressants. And this is a drug which prolongs the QT interval. This is a particular thing in ECG, and this drug prolongs the QT interval and makes a heart more susceptible to development of irregularities, which is called arrhythmias. And this particular thing is called long QT syndrome. And these people are already taking these tricyclic antidepressants, which they don't share with other people. So other people also don't know that they are on antidepressants, because nobody wants to say that he's depressed and taking medicines for it. But some of them are. And on the top of that, when they develop sort of sore throat or viral fever, and they are prescribed erythromycin and azithromycin group of drugs. So these drugs also increase the QT interval. And when two mechanisms are there for prolonged QT interval, this makes the individual at very high risk for developing arrhythmic disease, which we called VT, going to VF and leading to cardiac arrest. So it is very likely that these people may not be having any heart disease or heart attack, but rather they have this arrhythmic problem because of, first of all, taking antidepressants and not telling anybody, and on the top of taking the drugs of the group of erythromycin and azithromycin, which also prolong the QT interval. Likewise, I also want to bring to your notice, during the COVID time also, we saw a lot of cardiac arrests. And again, at that time, if you remember, people were prescribed drug called hydrochloroquine, to prevent COVID, and a lot of people were taking that. And on the top of that, if they developed this sore throat or fever, maybe because of COVID, they were also prescribed erythromycin. So again, there was a combination of two drugs prolonging the QT interval, and many of the deaths during the COVID time, especially on those people who were taking chloroquine, could have been because of this long QT syndrome causing arrhythmias and arrhythmic heart death, and which was put as heart attacks. So this was my message. So what I want to say in summary is that if you are taking any drug, you be very careful, and you take your doctor's consent and his opinion before starting any new drug. And if you go to doctor for another problem, and if you are already taking some medicines, you please inform the doctor what medicines you are taking, so that the doctor does not prescribe you another drug which interacts with your previous drug. So thank you so much, and again, congratulations for World Heart Day.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.